You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new treatment option for people that are suffering with insomnia, anxiety, and depression. With us we have Dr. Mikell Parsons. Dr. Parsons is the founder of Naturopath Health Center in Fresno, California. Dr. Parsons, welcome to the program.
It's wonderful to be here.
Now, before we get into today's topic, tell me a little bit about your center.
We have a phenomenal facility that we've set up. We really want to focus on those patients who are the walking wounded, the people who have gone to other facilities, can't get a clean idea of what maybe is wrong with them.
I mean, and you said that when you say walking wounded, people that can't get a diagnosis, or their primary care physician can't get to the bottom of their problems.
Yeah, and they feel
right?
bad. Yeah, they feel bad. They know there's something wrong, but maybe their lab work is normal according to a traditional interpretation of their lab work. But they know something's wrong. They don't have the energy, they're having problems sleeping, and those patients, you know, they don't know where else to go.
Is it that common, though, that they can't find what's wrong with somebody that feels lousy?
It is overwhelmingly common.
Really?
Because in allopathic medicine, they're trained.
Allopathic medicine, what do you mean?
Medical doctors, MDs, DOs.
Traditional medicine,
Traditional
as I would
medicine,
think of it. Okay.
Yes. They're trained to look for disease.
Okay.
And someone doesn't go to bed on Friday night and wake up Saturday morning with a thyroid disease.
Okay.
There's been years and years and years of warning symptoms and flags that gives a practitioner like myself a clue that there's something going on in their physiology. They're in the gray zone.
Okay.
They're on the road to potentially developing a disease. They aren't quite there yet. That's the area that I have a passion for.
Are you seeing results? I mean, people come in, they say, okay, doctor, I haven't, they can't get to the bottom of it. And then those things are turned around.
Every day.
Really?
Every day. I have people come in who may have had various health issues for 20 years and they're just existing. We get them back on track and they get their life back. And
I mean, you do believe in a lot of traditional medicine.
Oh, absolutely. Okay. I will be the first to tell a patient, you need to go and see someone for an antibiotic, or
like
you know, this is something
doctor.
that you need medication for.
Now, before we get into anxiety, insomnia, and depression using this technique with NIT, this new technology, your background, your training. I mean, traditionally trained as a doctor of chiropractic. In fact, I go to some of these seminars, the functional medicine conferences, and it seems that you're always there. I see you there in the background, even if I don't say hi. So tell me about that.
My foundational training is a doctor of chiropractic.
Okay. And
I specialize in functional medicine and nutrition. That's truly where my passion lies. And I would say probably 80% of the patients I see are coming to me for nutrition.
Now, you're a clinical or a certified clinical nutritionist, is that correct?
Yes, certified clinical nutritionist. I have my diplomate in nutrition, and I also have my diplomate in chiropractic neurology.
Okay, now you were assistant clinical professor at the University of Bridgeport. What was your role there? What did you do?
I taught a lot of different classes. I taught gynecology, geriatrics, dermatology, differential diagnosis of eyes, ears, nose, throat. That's why I have such a broad foundation in my practice, you know, and it's not just one specific thing. I do a lot of women's health.
Yeah, I asked you, you say about 70% or more is nutrition in your practice.
Yes.
And then this new neurointegration therapy, which is why we invited you on the program today.
Yes.
Let's start there.
Okay.
Neurointegration therapy, what is it? And what are you using it for? Because today we're talking about anxiety, insomnia, and depression.
Neurointegration therapy falls under the category of biofeedback, but it's biofeedback that's more cutting edge, state of the art, because we're actually able to do almost like a live EEG. Now, a traditional EEG is a test that's ordered to look at someone's brain waves and to assess, are they having seizures or not?
Okay.
So it gives us a lot of information about the brain waves that are being produced at any given point in the brain. What we're able to do is place sensors on the patient's head, and I'm able to look at the screen and get an idea of, you know, are they producing a lot of those high frequency brain waves that can cause stress and anxiety? Or is their brain working a little slower?
So if a person, let's take insomnia. It's a big one. A lot of people have a tough time with it.
Huge.
So with this person, they go to your office, you hook them up to the machine, and then what happens? And I'm sorry for interrupting you, but go ahead.
I will forgive you.
All right, all right.
One of the things that I will look for is what's causing the insomnia. Is it the insomnia where they can't fall asleep or they can't stay asleep? Is their brain not shutting down? You know, there's certain stages that we have to go through from a brain standpoint to allow us to finally be able to fall asleep and get in that deep sleep.
Okay.
For some people, they don't turn the brain off. They never go through those stages. Their brain is turned on, meaning it's over producing those high frequency stress type of beta waves. You're not going to be able to sleep. So when we're doing the NIT, the neurointegration therapy, what we're doing is the patient's either going to be listening to an audio CD, something relaxing, or they're going to be watching a movie. If we're doing it with a child, we're going to be watching a movie, so they're entertained. And when the brain is working aberrantly at the incorrect frequency, the audio will stop. It'll just stop. Well, the brain likes pleasure, and it likes to hear and see things in continuum. It doesn't like a skipping record. That's annoying. We don't like that. So the brain then tries to figure out what does it need to do to get that pleasure back. So to coach the brain to get it back on track, we have the patients using what we call photic stimulation. So they're wearing goggles that are a certain color.
Are they blinking? Is it
with flashing lights. So if we want to slow down those overactive brain waves, we have them in blue glasses with flashing lights, and the lights are flashing.
So you're training the brain?
We are retraining the brain how to work correctly.
Okay.
The flashing lights act as the coach, and they're flashing at the frequency we want the brain to work at. So the brain then will figure out, okay, this is what you want me to do. When the brain hits it, the audio plays again. That's a positive reinforcement of the brain.
So without really having to think about this treatment, the brain gets retrained, you're saying?
Yes.
I mean, it's hard to understand.
It is.
Or at least for me to understand.
It was hard for me to understand it as
I mean,
well.
were you skeptical?
I was beyond skeptical. I'm trained to look at things scientifically, and I always want to know the why, and I want to know the science behind things, and I am very protective of what I
It sounds gimmicky,
do with my patients. It does.
When I heard about this.
And in my initial training, I had never been trained in this, so this was very new to me.
So initially, were you going to use it for insomnia or anxiety or the brain fog or all of those things?
I didn't even know, to be honest with you. I was so exhausted, I couldn't even make a rational decision. So I sat down and had a session there at the conference. And as she was hooking me up and she was looking at what my brainwave was producing, she said, "Your memory must be horrible, and you must be having a lot of fatigue." I did not tell her anything, so that caught my attention. So I did a couple sessions at the conference. I left with the information, and I thought, you know, this is a big investment. I still don't understand how this works. You know, I don't know. So I thought about it and thought about it. In the meantime, I've been trying to do more nutrition, more things, more testing, getting a little bit better, but nowhere near where I needed to be. Ended up investing the money primarily to fix me. At that point, it was all about getting me and my health back on track. Once I started doing the sessions at the appropriate protocols, I got my brain back.
Really?
I am telling you.
How many sessions?
I probably did 30 sessions. And I was doing multiple sessions a day. And I was starting to feel better rested. I was starting to have more energy. And I could tell when I'm back on, when I'm multitasking and I'm planning. I'm a big planner. And I started to be cognizant of, okay, oh, this is my practice. Wow, look at what it's
Is it really that dramatic?
It changed my life.
Have you seen that happen with patients?
But at that point, I didn't even want to do it with patients. I was keeping it all to myself. And I thought, you know, I'm not sure if my patients are ready for this. So I wanted to just kind of hang on to it. Had a patient walk in who had a head injury. I recognized the signs, the fatigue, the brain fog, the inability to plan, and I said, okay, I'll do it with this one patient.
Okay, we're gonna have to finish that story after this break. This is good. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Parsons, and we're talking about a new approach with NIT technology to help people with anxiety, insomnia, and depression. We'll be right back.